know what is integumentary system. The integumentary system is the body's outer covering that protects us from injury, germs, harmful UV rays, and water loss. It consists of the skin, hair, nails, and cutaneous gland. For the cutaneous gland, there are two main types of cutaneous gland, which is sebaceous glands and sweat glands. These are the main parts of the integumentary system. Firstly, we have skin, which is the largest organ in our body. It covers the entire body and acts as a protective barrier against injury, germs, and water loss. Next are the cutaneous glands, which are glands found in the skin. They are divided into two types, which is sebaceous glands and sweat glands. Sebaceous glands produce an oily substance called sebum that keep the skin and hair soft and moisturized. Sweat glands produce sweat to cool the body and remove small amounts of fats. Another part is hair. Hair helps protect the scalp from sunlight, keeps the body warm, and allows us to sense light touch. Lastly, nails. For nails, it protects the tips of our fingers and toes. They also help us hold and pick up small objects more easily. So, these parts of work to protect our body and keep it healthy.
Next, I'll be explaining the structure of the skin. The skin is the largest organ in the human body and it consists of three main layers: the epidermis, dermis, and the subcutaneous layer. Each layer has a unique structure and important function in protecting and supporting our body. First is the epidermis, which is the outermost layer of the skin. This layer serves as the first barrier that protects our body from bacteria, chemical, injuries, and harmful environmental factors. The epidermis is made of specialized epithelial tissue and does not contain blood vessels. Because of this, it depends on the lower layers to receive nutrients. This layer also contains keratin, which is a strong protein that helps make the skin waterproof and protective. In addition, the epidermis contains special cells called melanocytes. These cells produce melanin, and the pigment responsible for skin color. Melanin also helps protect the skin by reducing damage caused by ultraviolet rays from the sun. Next is dermis, which is located beneath the epidermis. The dermis is much thicker and contains connective tissue, blood vessel, nerve endings, hair follicles, sweat glands, and sebaceous glands. This layer is very important because it helps us sense touch, pain, pressure, and temperature. The dermis also contains collagen, which gives the skin strength, flexibility, and elasticity. The deepest layer is the subcutaneous layer, also known as the hypodermis. This layer is made of loose connective tissue and fat tissue. Its main functions are to connect the skin to muscle, store energy in the form of fat, cushion internal structure, and help regulate body temperature by providing insulation. In conclusion, the epidermis, dermis, and hypodermis layer work together to protect the body and maintain healthy skin function.
So next, I will explain about the skin-related structure. These which include the sebaceous glands, sweat glands, hair, and nails. This structure works together to protect our body and help maintain normal body functions. First, let's look at the sebaceous gland. Sebaceous glands are located in the dermis and closely associated in the hair follicles. Their main function is to produce sebum, which is an oily substance. Sebum helps lubricate the skin, keeping it soft and preventing it from becoming dry. It also helps discourage the growth of bacteria, which protect the skin from infections. Next are the sweat glands. Sweat glands are found on almost all body surfaces. There are two types of it, which are apocrine glands and eccrine glands. Their main function is to produce sweat and also known as perspiration. Sweat glands help regulate body temperature by cooling down the body when we are hot. It also helps maintain body water content and remove a small amount of metabolic waste of the body. Now let's move on to the hair. Hair is made of dead protein cells that contain a hard keratin. It grows from hair follicles and its color is determined by melanin. So what is melanin? Melanin is a natural pigment that gives color to our hair, skin, and eyes. The amount of the melanin determines whether a person's hair is black, brown, blonde, or red. It also helps protect the skin and hair from the harmful effect of ultraviolet or UV rays from the sun. The main function of hair is to help control body heat loss, so it plays an important role in maintaining our body temperature. Lastly, let's talk about nails. Nails are also known as unguis. They are made of hard keratin and protect the tips of our finger and toes. Nails also help us to grip and pick up small objects more easily. Nail consists of 6 main parts, which are nail body, nail bed, free edge, lunula, cuticle, and nail root. First is nail body. Nail body is the visible part of the nail. Second is nail bed. Nail bed helps nourishes the nail while free edges help extend beyond the fingertip. Fourth is lunula. Lunula is where new keratin cells are formed. Next, cuticle. Cuticle function is to protect the nail roots, and finally the nail roots, which it anchors the nail in places. So in conclusion, the sebaceous glands, sweat glands, hair, and nails are important skin-related structure. Together, they help protect the body, regulate the body temperature, prevent infection, and supports our daily activities.
Now, let's look at some common disorders that affect the integumentary system. This disease can involve the skin, sweat glands, sebaceous gland, and hairs. Now, let's look at some common disorder is acne vulgaris. It is a chronic inflammatory disease caused by excessive sebum that production that block hair follicles. Common symptoms include pimples, blackhead, whitehead, and inflamed skin. The second disorder is hyperhidrosis. This condition causes excessive sweating even without physical activity or hot weather. It commonly affects the hand, feet, underarm, and face. Another common disorder is alopecia, which refers to partial or complete hair loss. Hair may fall out gradually or in patches, leaving visible bald areas. Another common disorder is alopecia. Next, dermatitis is an inflammation of the skin that can occur after contact with chemicals or allergens. The skin becomes red, irritated, and itchy, causing the person to stretch the affected area. Last disease, psoriasis, is a chronic autoimmune skin disease characterized by red patches covered with silvery scales. The affected skin is often dry, cracked, and itchy. In summary, this disorder affects different parts of the integumentary system and present with different symptoms. Early recognition of this condition help ensure timely diagnosis and appropriate treatment.
Next, I'll present a diagnostic procedure. First, biopsy, a procedure where a doctor removes a small piece of living tissue from the skin. Then they look at it under a microscope to confirm a diagnosis. Second, exfoliative cytology. Cells are gently scraped from a skin wound or tissue. These cells are then examined under a microscope to check for fungal infections or early cancer cells. Subsequently, treatment procedure for skin cancer and growth. Cryosurgery, the doctor uses extreme cold to freeze and destroy abnormal skin cells like warts or precancerous spots. Second, cauterization. This means destroying skin tissue by burning it. It uses heat to remove bad tissue and stop bleeding at the same time. Third, electrodesiccation. This means destroying bad tissue by using an electric spark to dry it out and kill it. On the other hand, treatment procedure for infection and skin inflammation. Topical steroids. These are creams or ointments applied directly to the skin. They are used to treat various skin disorders by reducing swelling, redness, and itching. Second, retinoids. These are medications derived from vitamin A. They are used to help control skin cell growth. Third, photosensitizing drug. This is a type of medication that makes the skin extremely sensitive to light, especially sunlight. When a patient takes this drug and is exposed to light, it triggers a reaction that helps destroy abnormal skin cells. Last but not least, treatment procedure for skin injuries and burn. Debridement. This is the process of removing dirt, foreign objects, and dead skin tissue from a wound. It is very important because it prevents infection and helps new healthy skin, which is granulation tissue, grow back faster. Second, dermatoplasty. This is replacing damaged skin with healthy skin tissue taken from another part of the body or a donor. In conclusion, the integumentary system is much more than just the outer layer of our body. It acts as our primary shield against the outside world. From the skin layers that block harmful bacteria to the glands, hair, and nails that regulate our temperature, every component plays a vital role in keeping us healthy. When diseases like acne, psoriasis, or skin cancers disrupt this system, diagnostic procedures and medical treatments step in to restore balance and heal the skin. Ultimately, taking care of our skin means taking care of our entire body's health and well-being.